Bruce, you must have something really good too.
Of course I do. It's Bruce Danielson, and I guess I'm here to entertain you too.
Good afternoon. Welcome to today's informational meeting of August 25th, 2020. Before we begin, I want to highlight the fact that we have an aggressive schedule of meetings today. We have a joint meeting with Minnehaha County at 5 o'clock, and then we need to go down to Canton for a joint meeting with Lincoln County. So we need to be mindful of the time. The first item up is City Council open discussion. Any open discussion? Seeing none, we'll move on to the first presentation. And I would also note, I think we have Councilor Christine Erickson on by teleconference.
I'm not sure.
Yes.
Yes, okay, very good. Welcome, Councilor Erickson. First presentation.
I'm here too.
Councilor Kiley as well, thank you. First presentation is a COVID-19 update by Director Jill Franken. Welcome.
Hi. Good to be here this afternoon, and I'll try and be as brief as possible. I don't have a presentation because really the information that I would share is easily accessible. If you go to siouxfalls.org/COVID-19, every day that information is updated, and there's a lot of good, valuable data, et cetera, that you can go to and look at anytime you wish. So. But we do want to just give you just a little bit of an update on some of the activities and things that we're seeing as far as, how things are trending. And first off, one of the things I know you as a city council pay close attention to, and that is the hospitalization rate. And hospitalization rates have been really staying quite steady in the last number of weeks. We've been running anywhere from about 25 to 40 hospitalizations total for both Avera and Sanford. We have been meeting with them on a regular basis. Right now, we've been meeting really just every month. We touch base with them, but we also have an open door and open phone line. So if they need to get in touch with us about any concerns they're seeing, or on the other side, anytime we need to touch base with them, we're communicating back and forth. But right now they're feeling very good about the capacity to handle what's coming to them in our community specifically. I'm not speaking for them system-wide, of course, but certainly what they can handle here is, or what they're receiving is well being able to be handled. So really, we'll continue to watch that. We'll continue to monitor that very closely. But at this time, we're not seeing any kind of a subsequent surge to any of the increase in cases that we've been seeing across the state as of late. So number of new daily cases in our area in Sioux Falls. When you think of our MSA, it's been pretty dynamic the last week or so. You've been seeing dramatic kind of increases and then decreases. And surprisingly, with all of that, we're seeing a very, very slight downward trajectory. So I guess there's some room for caution because of the rates have been, we've had some pretty high days comparatively for what we've seen over the summer. But we're monitoring that as a trend as well, not just looking at it day by day. And so far, we're okay. We also know that our active cases is kind of taking an upward trend. When you think of the number of people active with COVID in our community, when you look at where we were at, I think it was around May 11th was our peak, where we saw like over 1,200 active cases in any one day of COVID in our community. We're now running around, we had a peak of about 600. We had dropped really low in the 250s most of June and July, and now we're starting to see that uptick a little bit. But now recently, in the last few days, that's starting to kind of show a little downward trending, so hopefully that'll continue in that direction. And, like today, for example, just a couple days ago, we had a pretty high rate just in Sioux Falls MSA, but now today it's 18. And so it's just really something we continue to have to keep a close eye on, but nothing that's worrying us right now. Probably the biggest worry is our positivity rate. That's been really running well above 5% for our MSA on a weekly basis for about the last 4 weeks. And that rate is really going to tell us that we're doing enough testing in our community, because if we're testing at high numbers and can get that positivity rate under 5%, We can feel pretty good about the surveillance, if you will, that's happening in our community. But our rates are pretty high, and so we're seeing that means we're either not testing enough or we're seeing more rates of COVID infection in our community. And in my estimation, it's because we're not doing enough testing. And so we are having some internal dialogue about how we can support some of the community efforts to maybe do a little bit more testing in our community, especially with some of our vulnerable populations. That's in our wheelhouse and the area that we focus on in the health department anyway. So, I think then, just to give you kind of an update on some of our actions, you probably well know that internally with the city, we've got some pretty robust work happening to make sure people are safe in our workplace. We had a number of individuals across the city that were working from home during the early stages of COVID, and now most, if not all of those employees are back at the work site. And so how are we managing through that, having more people in the workplace and making sure that we're managing that well and keeping transmission rates minimal, if non-existent. And so things that we're working on, and we've kind of dubbed it as Safe at Work Together campaign to make sure that we're working together and staying focused on that. So it's the things that we talk about every day and how to mitigate the spread that we're focusing on in the work site as well. In addition to that, you hear a lot about social and emotional health with that. So we've got some real ways that we're really managing and trying to manage that with each other in the workplace too, that we gain and continue the level of respect and compassion and empathy and understanding that we all need with each other in the work environment as well. So checking in with each other, being respectful, flexible, patient, being positive and supportive, embracing ways that we can be more innovative with each other and how we're working together and collaborating together and how we're providing that appreciation for each other. So, the thing to remember too is we still actually have a resolution in place, which was put into action on May 26th. And so that too has some, community suggestions as to how we can continue to make sure we're mitigating the spread. That's still in effect actually for our community. To be diligent in our behaviors, to make sure vulnerable populations are being safe, and that we're doing our part as a community to mitigate the spread. SOAR, our internal city technical assistance and expertise that we're providing out into the community, that group is still very, very active. Just to give you an update on the work they've been doing, they've had over 100 complaints investigated on things like social distancing and mask use. They've now had over 250 referrals. That means they've had questions asked of them. They've had, verbal assessments over the phone, emails that they've responded to, et cetera, from businesses like churches, salons, dance studios, restaurants, grocery stores, et cetera, entertainment venues and the like. And then they've reviewed plans for almost 20 events over the summer, so they've been busy doing all that work as well. The things we're continuing to be concerned about into the future, this week is now the Sioux Falls School District getting up and running, and our other school districts have been up and running as well. Colleges are starting to get up and running in our community. And with that, it's no surprise to anyone that that's coming with a lot of activity and dialogue and technical assistance that we're providing to those entities as well. And so one of the things that, we're obviously going to be concerned about in addition to, with where things will land with the schools in the coming weeks is with the oncoming fall hitting us and people turning more indoors, along with then seasonal viral illnesses such as influenza starting to come into our community. What is that going to do, for us as a community? How is that going to impact our community on top of then COVID also being present in our community? So really encouraging as soon as we start getting all our flu vaccine in, which we anticipate at Falls Community Health and the Health Department to get ours in September here, and starting as soon as possible with giving vaccinations, that as soon as we start hearing, the retail entities and the offices, the medical offices getting their vaccine, that we strongly urge the community to get their flu vaccine this year. And then, lastly, just all the things that we encourage our community to do right now. I think we need to double down and be even more judicious about how we're protecting each other, how we're keeping each other safe. If we want our kids to be able to stay in school, let's do our part as a community to make sure we're mitigating the spread out in the community. So with that, I'd answer any questions you have.
Thank you, Director. Any questions for Jill? Councilor Brecky.
Director Franken, these recent spikes, is there lots of times you have kind of an intuitive understanding of what might be causing it, like it's a hot spot here or something like that. Do you have any kind of explanation, scientific or data-wise, for what's happening? Because it is of concern,
I can't pinpoint. It's a really great question, Counselor. I can't pinpoint exactly cases to specific events. We're not privy to that information from the State Department of Health. Rest assured, they know where that's coming from, however, and that they're working on, contact tracing and getting people into either isolation if they're positive or quarantine if they've been exposed to someone who's positive. But it is no surprise that we would see some potential increase. We've had a lot going on in our state in the last few weeks, and so it stands to reason that we would have some impact from that potentially. Just a lot of activities going on, and even though they may be outdoors, some of them, many of them, they still end up congregating a lot of people together, which still can cause the risk of transmission.
Thank you.
Sure.
Councilor Starr, sorry.
That's fine. Let me get through all this. Director, a couple of things. One of the things we do as a council, we've been approving a lot of one-day alcohol permits that now create a large crowd of people that would be probably outside the realm of what we would say our SOAR team would take a look at. Does it make sense for us to continue to keep authorize those type of permits and things where we encourage groups of people to come together, or how do we balance that as a council? So we do value your opinion and what we're doing.
Well, Counselor, that is under your purview, isn't it, as a council? And so if you were to want a decision made that would perhaps set some sort of a limit on the number of people you would want to have them be able to have at any given function to mitigate the spread, at this time there is no requirement. There is nothing that's in policy at this time that prohibits events from occurring. And so what we do is we're just trying to help them do that as safely as possible through the guidance that we can provide. Oftentimes, that sometimes leads them to decide not to have an event. And so even though they might have, filed for an alcohol permit, I don't know this for a fact, but I'm going to guess there's some of those that probably have then decided not to hold their event. Once they've sorted through all the things that they should be doing, sometimes that leads them to decide not to hold something. I really think that would be for further discussion, because that's a pretty weighty topic to talk about how you might want to do that.
I get it. One of the other things that you talked about, complaints that you're receiving. I did a police ride along a couple of weeks ago on a Saturday night, and it's uncomfortable to go into some downtown businesses that have way too many people on a dance floor and in that type of establishment. Are we encouraging people to make a complaint or point out issues when people aren't following what we've kind of set in place? Or out of those 100 complaints that you've reviewed and investigated, do you get the cooperation that you're looking for?
Well, that's a good question, whether or not we're getting cooperation, but it is certainly, while I call them complaints for purposes of, it's how it's termed in our department, it's a complaint that's called in, then that really is that teaching opportunity and educational opportunity. Whether they take that into consideration is certainly up to them as an organization. Again, absent anything from a policy perspective prohibiting them from doing so. But we feel like that's important. So while we don't necessarily encourage people to call in because they want to complain necessarily about somebody, if that is information we receive and we can then go out and provide that education from a public health lens, I think that's good for the community to be able to do so. I would encourage all businesses, I'll just say it, to be consistent in their practices. If they're asking that their staff wear masks with their patrons, they should all be doing so. I see a lot of inconsistencies out there, even in outside venues, and I hear, and I know for a fact of some days staff, they might have people wearing masks and then some days they're not. And I think that sends a really tough signal to the community as to how to depend on that, especially those that want to go and patronize those establishments. If they know that's consistently done and they feel safe, I think we're going to see a higher economic return on that with more people going out, especially to our restaurants right now.
The one other quick one, or I don't know if it'll be quick. I'm never quick. I just picked up my 12-year-old daughter from junior high and said that one of the kids in her homeroom class tested positive, and that we'll probably be getting a call to isolate or for her to stay home for 14 days, depending on how close she was to this fellow student, which I having a hard time if they're in the same classroom that she wouldn't have been exposed, or how much, and when they pass in the hallway and the crowded. How does that affect the rest of the family? I know what the school's policy is to send her home for 14 days and have her go to class remotely, but we're going to start affecting a lot of people by the time we try to isolate and what's safe. And so how do we handle that when the public schools start later this week?
There's a whole algorithm that the state uses and a whole set of criteria that they work off of that, that sort of third generation potential exposure. And so a lot is based on timing, when your daughter was exposed, and if they found her to be a close contact, at what time would that be something where you now also need to, isolate or quarantine, I should say. But, I would tell you that I've been surprised at how many times people thought they were a close contact and that they'd probably be getting a call from the State Department of Health, and then they didn't, because we might think something is a close exposure, but they have their very specific criteria. So your daughter might have been in the same classroom, but if she was at the most opposite ends of that classroom, and it's possible that they wouldn't consider that a close contact. So. Mm-hmm.
Next, we're going to call on Councilor Kiley, who has a question, then we'll go to Councilor Erickson.
Thank you, Jill. Yes, if you could remain there. A question, because we went over this in quite a bit of detail early on in the pandemic about how to deal with quarantining during after an initial exposure. And could you just go into that? I believe it is still a 14-day period, and whether you're tested early in that quarantine period doesn't necessarily mean that you're not going to come down with COVID. You could still come down with COVID on day 14. I think maybe if you could just go over that and refresh our memories, because I think it's been a while since we've discussed that, and it might be good for the public to hear as well.
Sure. So if you are tested positive, that's considered then, you are considered someone who needs to be in isolation. And so sometimes that gets confusing between quarantine and isolation. It's when you test positive that you need to now specifically isolate yourself from someone or from others. And so you have to do things like, separate yourself from your family members, sleeping in a separate bedroom, using a separate bathroom, all those things that can allow you, not making sure surfaces are for sure very clean if you go out into the kitchen. But they even recommend, maybe food should be brought to your room rather than you being out and about into, the house itself. And so there's all kinds of criteria or recommendations that they make and give you so that you can make sure that you're not exposing other family members. They, though, have to quarantine. And because they have been exposed, they're now having to quarantine until it's definitive that they have not been contracted the virus. And just because you might get tested within that 14-day quarantine does not mean that you won't convert to being positive for coronavirus within that time period. And so there isn't a magic answer in terms of, just go get tested and then you'll be determined to be fine, because until you pass through that 14 days, that's usually the time period that they would expect you to be remain in quarantine. Now, there's criteria once you are well, and there's a certain number of days, and Sandy, who I know, you have to be fever-free for at least 48 hours, and you have to have no symptoms for at least 10 days since the onset of your illness, I believe it is. And so those are the criteria then, if you have actually been positive for COVID, when you can come off being under isolation. The State Department of Health does a nice job. They usually check in with everybody a couple times a day, or like every other day, or a couple times a week, to make sure that they're touching base and how are you doing with your isolation or your quarantine, especially those that are isolated, that are positive. I'm not quite so sure how often they're covering people that are just under quarantine and haven't been found to be positive. And usually in Sioux Falls itself, if you have been found to be positive, you should be getting regular contact with your healthcare provider. They're checking on you and making sure that your condition hasn't worsened if you're home, and just touching base with you through those kinds of case management services as well. I hope that answered your question.
Well, it did. I mean, it sounds like there's basically two scenarios. If you've tested positive for COVID, or if you've been in a close contact with somebody with COVID.
Yes.
And if you've been in close contact with somebody with COVID, you should still be quarantining for that 14-day period, regardless whether you've tested negative during that 14-day period.
Yep, that's a great summarization. And again, you would be identified as being in quarantine, absolutely, if the State Department of Health contacts you. I know some people will say, they'll just declare themselves needing to be quarantined, but the State Department of Health will absolutely determine if you need to be in quarantine for sure or not. So.
Well, thank you very much. And I think that is a point that we need to do all we can to get that information out and make it clear to everybody. Because as we have increases, as we've seen, especially in the past week, there's more individuals that have those close contacts, and we don't want to spread COVID unnecessarily. So thank you very much for the clarification.
You're welcome.
Councilor Erickson.
Thank you so much. And thanks for the presentation, Jill. I don't have any questions for you, but more of just a statement. How far we've come as a city without having to do an entire shutdown of our city, I think is something to certainly be proud of. We have got to get back to making sure citizens are receiving critical care and not foregoing important testing and surgeries. Just today, I spent most of my morning with my cousin who had her last breast cancer surgery, and one that they allowed it to be put off since last January. And so it's surgeries like that still need to be taking place, and really the importance of, as we move forward in the city, personal responsibility and being mindful of others. And, if you're supposed to quarantine, make sure you quarantine. If whatever we can do to make sure that we're doing our part as elected officials and constituents and citizens in here and leading appropriately, I think is so important. But I'm super grateful that a lot of the folks have felt safe enough to get back in there and be able to receive that critical care and really that preventative health care that a lot of people put off for so long. So thanks for the presentation, Jill. I appreciate the update, and I'm sure we'll be seeing you again soon.
Other questions? Seeing none, I'll just maybe ask a few. It seems like the science seems to be indicating that it may take more prolonged direct contact to contract it. No, I'm not a doctor, but what about touch surfaces. I've wondered about that, for example. If somebody has it, they touch a door handle and they just open the door, I come up 10 seconds later and open the door, touch seems to be where we have a lot of transmission. What do we know about that?
Well, actually, I think they would tell you the primary transmission is really when you're less than 6 feet from someone and you are not protecting yourself, and you have COVID and you don't know it and you don't wear a mask, that's your most likely transmission. They're finding that touching surfaces isn't as transmittable. It still can transmit it. Don't get me wrong. We should still be doing those things like washing our hands very frequently and making sure, because one of the things you do is you touch something and then you touch your face. So don't touch your face, please, and make sure you're taking care of how you're taking your mask on and off. But that's still a way to transmit the virus. I'll share with you, I'll send you the link to the State Department of Health. Has a really nice little infographic that talks about, if it's paper, it's this many days it can live on the surface. If it's, metal, it's this many days, et cetera. And so I'll send that out to you just as a way, if you get questions on it, you can easily forward that on. But certainly that physical face-to-face contact and the aerosolization of those the COVID virus is the best way to transmit it.
Okay, good to know. Testing methodology, when it comes to positivity rates, do you know if the different healthcare systems and you being a provider have the same standard of when we will test? For example, we'll only test if you're symptomatic, if you ask for it, or does it vary across providers?
I would say it's a little bit variable, only in that it's a lot dependent on testing supplies. If they're starting to see a run on testing, you might start needing to kind of conserve, or you're low on this on the reagent, or you're low on the swabs, or you're low, there's all kinds of different reasons that can cause the kits, you can be low on the kits, et cetera. And so there's just a lot of reasons why you might have to adjust who you're going to test and when. So that's as much as I can say about that.
Okay.
Absolutely.
And then finally, I don't remember if the mayor or maybe one of the representatives from the healthcare providers made a mention of it. I think they did at the press conference, and there was essentially a number that was mentioned, a number of so many. If there were so many at each healthcare system hospitalized, we would move to the next tier. Could you speak a little bit about where that number came from? And
Sure. Well, at our last call with both Dr. Wilde and Dr. Elliott, I think that was just last week, I just asked them, you seem to be doing really well right now. You seem to be able to be handling the demand and have good capacity. At what point would you say it's starting to stress your system a little bit, that we really need to say, this is that first level of, okay, we got to really think about what's going on in our community. And that's when they said, if one of us gets to 40 average daily census or a census that day, not both, but even just one of us all of a sudden bumps up to 40, that might be a number that a number of people in the hospital that kind of gets us going, okay, what's going on, and are we going to continue to see that increase? That was where that came from.
Okay, so they would be the ones that came up with the exact methodology and...
Well, I think to say exact methodology, I would caution you in using that as the term, but that's really what we talked through. Yes, and they were the ones that kind of said, that's probably when we, as a unified command, should say, we better be thinking about that. Now, that number could become different if they start getting into the 30s or 40s more consistently. We kind of dip back down into the 20s quite a bit for both hospitals total. But if we start getting into the 30s and 40s between them as a total, maybe they'll decide, we're handling this just fine, and it might take a little higher number for us to get really concerned. So I would only say that's just at this point in time, way that we kind of landed on, okay, if you get to that point, you're going to give us a call and you're going to say, not that they would have to call us because we know their hospitalization numbers every day without them having to tell us that, which is nice. we'll have another conversation. So,
Understood. That number's not etched in stone tablets. This is dynamic. We keep learning every day,
right.
and so.
Yep, exactly.
Okay. That's fair enough. Okay, thank you very much.
All right, thank
Appreciate it. Next up is the 2021 Experience Sioux Falls, formerly the Convention and Visitors Bureau for Sioux Falls, bid tax budget, presented by Terry Schmidt, the Executive Director. Welcome, nice to have you back.
Good afternoon, everybody. Nice to be here and nice to see you all. And those of you who are calling in, nice to hear your voices. Okay, I'm going to speed here really fast because I've got a lot I want to go over very quickly. Krista's going to run the PowerPoint, and she's also going to give me the kick when it's almost 15 minutes, so I'll go quickly. Again, Terry Schmidt, Executive Director, Sioux Falls Convention and Visitors Bureau. You have a packet before you with the budgets as well as the collateral that we are responsible for printing on an annual basis. As you can see on the screen, we are moving toward calling ourselves Experience Sioux Falls. That's a name change that is coming through our most recent strategic plan. And we are not technically there yet. We still have some legal work to do, but we are on our way to that. So you'll hear me call us both names, I suppose, today. The bid is why we're here today, to go over that budget with you and ask for your approval either, I guess, today or at the next meeting. The bid was formed in 2011 by the Sioux Falls hotels. They came forward and said themselves, CVB doesn't have enough money, we've got to do something to get them more money to compete. And so they came together, went to all the hotels, got everybody to agree that they would impose a tax on themselves for $2 per room per night sold. That is our main source of funding. We are also funded by the 1% room tax that the city, it channels through the city and then comes back to us. All of this in order for us to stay competitive. Our bylaws say about the bid to provide funds to the Sioux Falls Convention and Visitors Bureau for the marketing and promotion of the visitor industry in the city of Sioux Falls and increase the room night sales of lodging facilities within the business improvement district, meaning within Sioux Falls city limits. Ultimately, it was to create impact throughout the city. As I said, we've got these two forms of income. It all comes from visitors. The hotels don't pay it themselves, the restaurants, it is from people who stay in the hotels. They collect the $2 bid fee and it's passed to us. Today in Sioux Falls, we have 61 hotels, 5,387 hotel rooms. The Hyatt Place is set to open in September, and that will add another 112 rooms, bringing us to a total of 62 hotels with 5,499 rooms. In 2019, of the visitors that we were able to count, 1,810,614 visitors came to Sioux Falls. That's people from 50 miles and out. Those 1.8 million visitors created an economic impact for our community of $455 million, almost $456 million. Think of the jobs that created. Think of the tax money that created. Think of the outlying areas that all benefited along with the citizens from those visitors coming into our community. Over $1.6 billion, 40% of all visitor spending occurred in southeast South Dakota in 2019, outnumbering the Black Hills region for the very first time, which we danced in the street over that. That was pretty cool to hear. Minnehaha County, 74% of the 1.6 plus billion came out of Minnehaha County, and 29% of all visitor spending in South Dakota was from right here. Also, more than 46% of South Dakota's tourism generated labor income goes to employees in the Southeast region. Our STAR report, which is a national report that we get that counts hotel rooms, told us that in this past July, we were down in Sioux Falls by 43.7%. Year-to-date, noting that we were down 32.3%. What I'd like to do at this time is show you our budget. You're able to see up there our competitive set, our competitive cities. We certainly are running with not the people in South Dakota, but everybody from Omaha to St. Paul, Milwaukee is who we compete with. If you look at the actual budgets now, and I believe we are starting, yes, there we are with the bid budget at the top of the page. Okay. This current year right now, the bid budget was $1.9 million. For this next year, it will be $1,250,000. We're making about a 35% cut. The administration of the bid, the administrative costs, 66.6% are on the bid side. That's for all the administrative costs. Going down, if you look at fixed program, we have a $30,000 cost in for this coming budget. That is something that was contracted prior to even, well, gosh, 6 or 8 months ago before we ever knew about COVID. So that is something we have to honor because we did contract for it. Under convention assistance, our total group assistance, that's paying our employees to go out and be on site at conventions, is $5,100. Convention supplies, those name badges, the folders, the bags, the printing ink for those people will be at $12,255. Now we get into the sales development, the really tough stuff. Digital strategy. Last year, our budget was $501,737. We have cut it to $278,623 for the coming year. That digital strategy includes everything from leisure and B2B media, strategy, and execution, platform fees that track advertising and the return on investment into hotels and flight bookings, along with our user-generated content that helps market Sioux Falls. TripAdvisor and Expedia partnerships are also included in this, as well as all of our app fees, website miscellaneous, our videos, our domain hostings, all into that lump sum. This is a huge cut for us in the social media world. Event ads, gone. Sports publications, we brought it from 7,300 down to 3,500. One ad. Trade publications, we brought it down. Actually, it wasn't brought down. They had contracted prior to COVID ever hitting. That 32,000 is for 5 ads. We stopped all other advertising. Going down to bidding. Our requirements, pre-promo requirement commitments. There's $2,000 there. Last year there was 20. That is for the Golden Age Veterans Games that we bid and brought here. It's going to be a huge boost for Sioux Falls, but we did commit $2,000 to them on top of all the bid trip and everything that we had previously done. The incentive program, I have to be honest with you, we're in a position now more than ever where we're probably going to have to offer money. Because everybody, that competitive set we showed you, everybody is going after the business hard because everybody's hurting. So 15,000 isn't much when you look at the big picture. Planner promos and gifts, gone. Site visits and FAM tours. A FAM tour is a familiarization tour. We have to bring those planners into Sioux Falls, let them look us over and sell them because the people of Sioux Falls are really what sell people wanting to come into Sioux Falls for a convention, meeting, or event. Bidding investments. We previously had committed to 9 groups, in prior years. So maybe a year or 2 or 3 ago, we bid somebody, a group, and we said, if you come to Sioux Falls, the year you come, we'll give you $2,500. That's what that $21,000 is. Now look at that bottom line for bidding. This current year, $133,000. Next year, $68,000. Going down to travel, bid trips, none. Governor's Conference on Tourism, not. Sales blitzes, we had to cut them. Trade and travel shows, we left 7,000 in so the sales team could maybe do 2 or 3 virtual shows. Travel is going from 122.5 down to 7,000 for this coming year. Total sales development, 859,000 this year. This coming year, 396,000. Down under tourism promotion and advertising, travel publications, $4,200 compared to $58,000 this year. Group tour sales, gone. Rest Stop Fam, tours, travel writers, 500. That might buy them a couple meals while they're here. Thank goodness for our hotel partners, because we could not do these kinds of hostings without them. They step up and give in order for us to host these people. And then South Dakota Tourism Co-ops, that's everything from the state vacation guide to direct mail, campaigns, etc. We cut to 13.2 from 67,000. Bringing us down to the bottom, we will be at $1,251,750 for the coming year, which is $673,950 less than what we have this year. Okay, now with that being said, our budgets go through the bid board, and then they go to the Chamber of Commerce Budget and Finance Committee, and then they go to the Chamber Board, and then they go to you. So they get raked over, trust me, by lots and lots of eyes, line by line by line. Here's our realities right now. I'm calling this our great interruption. Man, we had a banner year set for Sioux Falls this year. It was going to be great. And the minute COVID hit, it's gone. So we're interrupted right now. I've never seen anything like this before. Conventions, meetings, and events have canceled and are still canceling. A few are rebooking for future dates, but some are still on hold. We have to do more with less staff. And by the way, see that crew out there? That's the CVB staff. They're warriors. They hit the street like none other. They work hard to bring this business in here, and you too. I meant to come over here a little bit. Making this stuff happen on behalf of the city. We have to do more with less. Several weeks ago, we furloughed everybody to try to save money. It killed me, but 2 weeks ago, I had to lay off one of our best employees. There's just no money. And I fear that I'm going to have to lay off more. Spending has been frozen since mid-March. We even canceled janitorial services for our office, and we all got together and said, we'll do it. So we're going to take care of the floors, the bathrooms, the dusting, the everything, and save $8,000 in this budget just to get us to be able to do maybe 1 or 2 more ads. We've got to be flexible. More than ever before, we have to do what has to be done in order to get more business here. We've got to get jump-started. If we have to plan and work an event, then we'll go plan and work an event. Patrick was out working softball this summer just to help them make it through that tournament. South Dakota average hotel occupancy in July was 64.5% because of Sturgis. The U.S. average was 44.6%. Western South Dakota in July, just Western South Dakota, ran at 70.8%, the Sturgis rally. Consumers want outdoors, they want recreation, we've got it. International visitors still want to travel, they're just waiting for the time to come in. Last year, we had 61 foreign countries sign in at the Visitor Center at Falls Park. Don't tell me we don't have international travel and visitors in Sioux Falls. What's our outlook? We can't stop thinking about the future. What are we going to do? How flexible can we be? What's our focus? We have to evolve out of this COVID thing even stronger than we were before. We're a marketing organization that represents this community. We have to do it now, and we've got to go forward because what we do now is going to affect the future. We've got to react quickly to all the changes that are going on and be able to handle those. The CVBs are economic development. It isn't just about visitors. It isn't just about hotels and just about restaurants. Think about it across communities. Sales and marketing is our thing. A CVB sales and marketing positions a city for companies to relocate, employees to move here, people to retire, choosing a college. We set the groundwork and the picture of what a community is, working all the way down to the citizens, maintaining that quality and upping that quality of life. We define and showcase this city as the best place in America, and believe our competition, as I mentioned earlier, they're stepping up their game. Right now, it is a game of survival. So, challenges: COVID, winter, and funding. The budget says it all. I don't need to tell you anymore. You can see the numbers. Funding is our core, and it's our biggest concern right now. We can't not exist without it. CVB in the visitor industry is well known as the economic engine in our community. Our messaging is the community's messaging. A great place to live becomes a great place to work. Employers rely on us oftentimes to come and speak to groups, to doctors, to CEOs about relocating here. And restaurants, venues, events, car rentals, everybody, all combined, it's what makes it great. So it's all about the comeback. I'm hurrying. I've got 10 seconds. The courage and commitment we have as an organization has been successful. The numbers prove it. Now we have to focus on the comeback. We need your help. We have the warrior mentality, trust me. We can get out there and sell snow to an Eskimo if we just have the money to get out there and do it. We have the will to win. We have an exceptional product with our community. We just need funding. So with that, I invite you to come to CVB Council, 4th Thursday of every month, but July and December. Alex, we got to get you to one. Bid board is 4 times a year. You're always welcome at that. And thank you for allowing all of us as a team to get out and beat the streets and fight to bring people to Sioux Falls. It's what our community is made of. So, did I do it? 5 minutes or 15? Close, okay. Questions?
You did great. I really appreciate the determination and tenacity of your team. I'm going to go to questions. Councilor Brecky.
Just a statement. You just show your trademark enthusiasm, and I think we all appreciate that, Terry. I love your warrior spirit, and we knew, as I told you before, I sit on the bid board, and we knew, because Sean has been filling us in regularly, of the struggles that you're having, but you've done a tremendous job of rebounding and being fiscally conservative and responding, so thank you.
Councilor Sale.
Yes, thank you for your presentation and your enthusiasm. You mentioned that there will be 62 hotel motels in Sioux Falls. Along with those employees within the restaurant and entertainment industry, do you have any idea how many jobs that is in Sioux Falls that are related to the?
Isn't it over 32? I think it's 32,000+. I honestly don't have that number in my head, but it's thousands.
Okay, thank you.
Others, including on the phone? Not seeing any. Well, I do want to say, as somebody who, I guess in my lifetime in the tech industry, I've been through the 2000 crash, 2001 September 11th, and 2006 when we had the real estate bubble crash. There will be brighter days. There were some very dark days, you know, so, but you'll get there, and it's just a struggle when, you know, obviously so much of your funding comes from really hotels.
It all does.
It's really pretty much about all of it. So without having that diversification, when that's struggling, you're in deep trouble, so.
I don't know if you knew that back when the bid was formed, we were getting about $500,000 from the general fund. And in our deal, it was, hey, city council, mayor, if you'll go along with us on this ordinance to form the bid, we won't ask for that general fund money anymore. And so back in 2011, that's how that transpired. And we've been on the tax dole ever since.
Interesting. Are there, how is it looking for conventions? Is anybody booking anything here at the convention center?
I know the convention center, I mean, the calendar looks pretty good. I recently asked for a breakdown of every group they have booked with knowing how many room nights each one. And there's some room nights, but not at all near where it was. And I know in talking to many of the hoteliers, they're scared to death for this fall, winter. You know, like I said, COVID, weather, if influenza hits right along with it, what are we gonna do? And we honestly, day at a time.
And maybe finally, where are you set up when it comes to reserves?
We do have reserves. We have about $1 million in reserves, and we will be dipping into those reserves just to get through this current year. Right now, we're already way over. And then next year, we're gonna have to go into those, and what we're afraid of is that we're gonna deplete them. But thank goodness we have them, but they won't even get us through to do. I have with me the budget for $900,000 of all those cuts that we had to make. And they're all in sales and marketing. What are we gonna do, you know? So we can, yes, we'll be using those, but it's still not gonna carry us.
Yeah, it's very difficult because the very thing that generates more revenue is what you're cutting. But what can you do?
Right.
Besides staff, really? And we don't want to do that, so.
No, because our staff are, you know, sales. I mean, I can hand you a piece of paper. Which would you rather have, that or one of these vibrant people sit down and tell you the story?
Makes sense. Well, keep it up.
Thank you.
Keep fighting. We'll make it through
Thank you all
this.
very much.
All right, great. If there's anybody who has any public input on anything we talked about today, you can have up to 5 minutes. Any public input? Seeing none, thank you very much. This meeting is adjourned.